the fact that it looks different, but at the same time,
Yeah.
I've never
You have to press different
Well,
buttons.
I never really wanted to have to go back to learning how to use a computer again, which is basically what you have to do. Thank you. Yeah. Right. Okay. So we'll carry on where we left off with some abnormal things in reptiles. We have, in this particular lizard's case, this is a little basilisk, female basilisk, and this particular one has obstipation, constipation, partly associated with eating the calcicyan that it was on, but also partly associated with a mildly scoliotic and kyphotic spine that this particular individual has, which is not uncommon again, particularly in some of the longer backed lizards with metabolic bone disease. So it's another issue that can occur during the growth phase in lizards in particular with suboptimal vitamin D, UV light and calcium levels. You may get bowing of the bones, but you may also get scoliosis and kyphosis of the spine, and that can lead to other problems. To be fair, considering the amount of calcicyan that this one's managed to get into its digestive tract, it probably would have been constipated anyway. But the scoliosis can be quite severe. So this is just in front of the pelvis here, and we've got a really significant sigmoid bend here, and we're getting obstipation associated with that, and it's also kyphotic as well. So these sorts of kinks and bends are well nigh impossible to treat. However, normal abnormal findings, if you like, would be this particular one here, which obviously has clearly at some point previously sloughed its tail and then regrown. So this is autotomy, which obviously doesn't occur in all squamates, but occurs in some. So a lot of the geckos, the iguanids will do that. Other skeletal abnormalities. We don't see too many cases of primary skeletal neoplasia, but from time to time osteosarcomas do pop up. They're frequently on the head of lizards. So this green iguana here has this tumour on the face, which is causing ulceration. It does cause a slight moth-eaten appearance. They're quite difficult to differentiate in the early stages from osteomyelitis. Osteomyelitis frequently results in far more aggressive looking, ironically, bone changes than the tumours do. So this is perhaps a slight difference from mammalian radiography, where bone cancers often do look spectacular, sunburst kind of arrays. The real sunburst arrays are usually osteomyelitis in reptiles. The osteosarcs tend to grow slowly. We do see hypermineralization, particularly with oversupplementation, but also associated with issues akin to metabolic bone disease. So ironically, we can see soft tissue mineralization in animals that have suboptimal levels of calcium. And this is a peculiar thing that can occur with a dystrophic mineralization. But obviously owners overdoing calcium, vitamin D in particular, and UV light, maybe inappropriately high UV light provision. And we can see in this chameleon here, this is a Meller's chameleon, we've got mineralization of the heart, mineralization of the carotid trunk, mineralization of the aorta, we've got mineralization of some of the pulmonic vessels, we've got increased density of the two kidneys down here in the pelvis. So basically mineralization of soft tissues, but actually also poor mineralization of distal extremities in this particular individual. For ultrasound, again, we can manually restrain most of the reptiles we're dealing with. We can do vagal responses, but it doesn't tend to be particularly effective in this case, because you're actually then contacting the reptile, so you're stimulating it, which tends to ablate it. And also, obviously, when you stimulate vagal responses, you slow heart rates. So if you're trying to do a cardiac assessment, you need to take that into consideration. Ultrasound access in things like snakes is dead easy, but it's usually from the ventral aspect, so you're often only imaging it in a ventrodorsal fashion. We can obviously do it in crosswise fashion, so we do longitudinally and crosswise, but it's always ventrodorsal. If you try it from the lateral, unless it's a very small snake with poorly mineralized ribs, you're going to get shadow associated with that. In the case of colonia, we obviously have the fossa beside the neck, and we also have the prefemoral fossa, which are your two main windows, acoustic windows to access. This one for the heart, and the prefemoral fossa for the kidneys, reproductive tracts, and potentially liver, depending on the size of the animal. This is the sort of image that we typically get. You often get an off midline image of the heart from a cranial aspect in colonia, because the heart sits immediately behind the neck, so it's not possible to get a midline sagittal image in it, and it is not possible to get a cross-sectional view in colonia hearts, but we can get an idea of the structure. So this is as the left aortic arch and the pulmonary artery, the ventricle, and it is often reported that a moderate amount of pericardial fluid is present in reptiles, particularly colonia. It's not been my experience. The vast majority of apparently healthy ones have limited amounts of pericardial fluid. As witnessed in this particular case, you can see a dark line around it, but not excessive amounts. Those that have significant amounts, I would suggest there may be a reason for that. There may be underlying issues, hyperproteinemia or something else going on. In the case of snakes, then these guys are dead easy to image the cardiac silhouette, and we can get a longitudinal and cross-section associated with it. There are some things that we should be aware of. One of those is that if you feed a snake, the actual size of the heart increases. So this is a relatively small, this should be 0.66 centimetres, not 0.66 millimetres. If it's a relatively small reticulated python, before feeding, 0.66, after feeding 4 days, 0.78. We get organ increase after feeding, particularly if there's been a period of anorexia or period of food absence and then a feed. We tend to see multiple organs will get bigger. Close up, the image of the heart is not what we would typically expect in a mammal, so this is a slightly better close-up image. But heart base is this end, heart apex is this end, and we can see this is the ventricle, the common ventricle. As you can see, it is more sponge-like, as we were talking about yesterday. It is not a series of discrete lumens, two lumens. There are little pockets within it. There is a corpus arteriosum, a corpus pulmonalis, so on the left side, corpus arteriosum, right side, corpus pulmonale, and a corpus venosum. We have a right atrium and a left atrium. Those are more typically associated with discrete lumens, but it's the ventricle that is more like a series of sinus tracts with no barrier between left and right side. And so left and right shunting, frequently right to left shunting, can occur bypassing the lungs. Particularly important in semi-aquatic animals when they submerge themselves, but actually reptiles can do this when noxious stimuli are present and in other cases. We can also see other issues associated with pericardial effusions. In this case, we've actually got a pericardial abscess in this case. So we've got this granulomatous mass. The cardia is here, and we've actually got evidence of an effusion going on in that area, relatively easy to pick up. In a slightly bigger snake, we can see a series of cross sections. So this is longitudinal, this is heart base, so this will be the typical sort of Mickey Mouse view that you would get at the heart base of a mammal. And what we're looking at here is the right atrium, the left and right aortic arches. Remember, they have two aortic arches that come out of the heart, go to left and right sides. They combine about halfway down the body of the reptile into a single caudal aorta. Actually, this is not in the right place. Caudal vena cava is actually here. This is the sinus venosus. Okay, so this becomes the sinoatrial node in birds and reptiles. It is a separate chamber in reptiles. So it is confusing, but the terminology for reptiles, frequently they're called three-chambered, two atria, one ventricle. You could argue that actually you could call them four-chambered because they've got a sinus venosus, a right and left atria, and a common ventricle. and actually they function as a traditional four-chambered heart with a sinus venosus, so it is actually quite complicated. Pulmonary artery is your central vessel, right atrium here, left atrium here, so we're at atrial level, pulmonary artery right in the centre there. And then, as I say, in a transverse again, right atrium in here, corpus venosus, corpus arteriosus will be down in here, but we're just off section, corpus pulmonale, left aortic arch. So it is not a discrete lumen. The heart itself is somewhat difficult to interpret. Pericardial effusions are usually limited, if any. A lot of people do report them as being very common, but actually in most cases this one is perhaps borderline significant. Most of them, they don't actually have significant pericardial effusions. It's only when we get clinical problems that they start to have issues. We can see other issues associated fairly clearly with ultrasound, and actually one of the areas that's good to ultrasound because it provides a little bit more information than radiography will give us are the kidneys. And the kidneys are difficult to visualize radiographically in certainly in lizards and colonia. They're easier to visualize in snakes because you can access them from the ventrum in snakes, in the last third of the snake. But in lizards in particular, they're in the pelvis. So they're actually very difficult to look at, to see on radiography. However, we can obviously direct from the lumbar fossa the ultrasound into the pelvic cavity to visualize kidney structure. And this is in a bearded dragon here. So this white line here is the dorsal roof of the pelvis itself. And we're looking at the kidney structure in here. And this kidney here has got granulomatous changes in it associated with marked differences in the echogenicity between different areas of the kidney. The kidney should be this slightly hypoechoic area. We've got echo-dense areas within it, which is typical of fibrinous granulomatous change with chronic granulomatous nephritis. This particular beardie did not have elevated uric acid levels. Certainly had a monocytosis and toxic heterophilia, and finding the source of the problem was the issue in this particular one. Actually, the ultrasound gave us a good indication that the kidneys were abnormal, and so we did endoscopic biopsy of the kidneys to make the diagnosis. So certainly suspect in this particular case. We can use other obvious modalities. MRI again in reptiles is particularly useful in things with a shell because we can start to look inside it. So this particular tortoise here, this is a midline sagittal view, so straight down the middle of the tortoise. Head ends this end, tail ends that end, lung field up here, heart here, comes out very dense. We've actually got a tumour in here, a pancreatic tumour in here. Liver over the top here, but the shell you can see is absent on the MRI. This is a coronal view through the middle of the tortoise. This is the spinal cord here, so the shell is round here but is gone. Lung fields, very loose areola, that often don't show up particularly well on the MRI. Muscles in here, and this is our pancreatic tumour in this area in here. And then this sort of, this is a sagittal view, cross-sectional view. This is a coronal view through the middle of the tortoise. Head here, forelimbs, hind limbs, and we've got the pancreatic tumour in here. This is muscle mass, liver in here across the body. So useful for looking at soft tissue derangement inside, particularly things with a shell. For endoscopy, in reptiles, Romain will talk to you more about sort of endoscopic surgery. The ones that are not particularly useful for endoscopy are snakes, unless you've got a very discrete tracheal lesion that you want to do, mainly because of their long body form, and so it is difficult to easily visualize with a short rigid scope anything in a snake unless you're right on top of it. Lizards, certainly doing coelomic endoscopy is useful, so we generally will go either side of midline, avoid the abdominal vein that runs down the midline, and from that site we'll be able to visualize the liver on the ventral aspect. If we then go underneath the rib cage, we may well be able to see the base of the heart, We may be able to reverse it and go back down in towards the pelvis to look at kidneys. And if we just go either side of midline, you're going between the two fat pads. So there are two big fat pads in most lizards that are connected into the pelvis, and they sit as sort of lozenges either side of midline. So if you just go lateral to midline, you'll avoid those. Colonia, obviously, the favoured site is the prefemoral fossa. It's difficult to see kidneys in colonia with endoscopy because you've got to turn the scope back and look back up into the pelvis. So the angle is quite acute, and sometimes it is difficult because when you bring the scope round, it then hits against the shell to look back. You may only see the cranial pole of the kidneys. Getting to the caudal pole, to be fair, in lizards, the caudal pole is difficult to get to as well because it's right into the pelvis. Some people have recommended actually cutting down lateral to the tail base in lizards just about where the pelvis ends to actually access the caudal pole of the kidney if you believe there's a lesion or you want to have a look in that area. For colonia, for looking at lung lesions, then drilling a hole, as we saw before, if we identify where a lung lesion is radiographically, we may then want to drill a hole down over the top of it so we can actually sample that site, and endoscopy then becomes really useful. So this is the normal open areolar structure of the lung of a typical reptile, in this case a tortoise. This here is congested pneumonic lung where we've got a lack of fine structure. We've got actually some pus down the bottom here anyway. We've got edema and congestion associated with abnormal tissue and inflammation. In a lot of other species, such as lizards, then using it to diagnose things like pre-ovulatory stasis, we can use ultrasound to do that. They tend to be slightly more hyperechoic. These yolks, remember, they're fatty in nature, so we don't tend to see the anechoic cystic ovarian disease, things that we see in guinea pigs and hamsters and gerbils. But typically these are possible to pick up on ultrasound. You need, with all ultrasound, it's worth just mentioning in recapitulation that putting the gel onto the reptile a good time before you want to actually image the reptile is a good idea. You need to get it to soak in depending on how thick the scales are, how large the scales are, so that you get the gel well worked into the skin. So a good 2-3 minutes at least before you're intending to want to image, just smear the gel on and let it soak in so that there are no air pockets between the scales. Otherwise your contact does tend to be difficult. It's common, obviously, you're doing X-laps anyway in a lot of lizards for internal body organs to be pigmented. So this is the inside of a bearded dragon, and the liver is covered with a melanin coat. This is the inside of a monitor lizard, and we're biopsying this liver here where we've got some really rather unpleasant hepatitis going on. And this actually just points out one thing with monitors in particular. With agamids and iguanas, when you open them up just to one side of midline, you're straight into the coelomic cavity. With a lot of monitors, you enter into a paracoelomic cavity, and actually the viscera are in a caul of mesentery, which is often deeply pigmented, and you have to cut into that to then actually access the viscera. So you pop through the body wall and you suddenly go, where is everything? It's just in a sort of there's a solid tube, like a sheath down the middle. And if you're right on top of it with the scope, you kind of go, I cannot see anything. You have to pull back a little bit in the tiny space you're in and suddenly realize, oh, right, okay, I need to make a nick in that in order to actually access the intestines, the liver, etc., because it's in a kind of a sheath of viscera down the middle. But yeah, endoscopy, a useful modality for minimally invasive stuff. So that's really covering reptiles. We're going to look for the last little bit at some other species that you might typically find either in small zoos or maybe even in private hands. And just really highlighting some common radiographic conditions, a few ultrasonographic conditions in particular, and just to give you a bit of a flavour of some other species. So we've got here mustelid, Asian short-clawed otter. What do you notice about this one? Yeah, kidney stones. Yeah, otters. Otters read kidney stones. They're incredibly prone to them, all species of otter. There are many, many different theories as to why. Wild otters, it does seem to be associated with location. So we tend to find that some otters in certain parts of the world are more prone to these stones than others, but they all in certainly captivity seem to be highly prone to it. Some people have suggested that it's because of a high purine fish diet and that maybe you should feed more shellfish. So some people have tried that and that doesn't often make a difference. Some people have suggested that you shouldn't be feeding lots of seafood to things like these guys in the first instance, so you need to feed them some rodent and avian prey to dilute it out. Yes, you can do that and they still develop kidney stones. So nobody's entirely certain as to exactly why. The stones are often typically triple phosphate or magnesium phosphate stones, so they are not dissimilar to some of the stones that we see in other carnivores. They form these typical stag's horn stone-like structures, and this represents the reniculate shape of the otter kidney. So they have a more like a cow-like kidney, a reniculate multiple lobular kidney, and so what we're seeing here is the collecting ducts for each individual renicule that are forming these stag's horn so-called calculi. Again, both kidneys are nearly always affected. One is usually worse affected than the other. There may be recurrent bouts of pyelonephritis. They may be completely asymptomatic in a lot of cases, but they're really, really common. This is a female otter. We often have a little bit of an os penis in the males. The heart again often looks quite large in relation to the body cavity. They're not quite as narrow at the thoracic inlet as ferrets, but they're pretty narrow, the typical mustelid body form, quite significantly bowed fibulae. But otherwise the body form is very, very similar to many other mustelids and small carnivores. If we look at primates, which are perhaps small primates, some of the more unusual species, or some of the species you might not be quite so familiar to, this is a brown capuchin. Obviously the first thing that's very blatantly obvious is the very domed, typical sort of simian head associated with these guys. Again, we've got a decent chest size in comparison to gut fill. Fairly prominent jaws, particularly lower mandibles, with closed rooted teeth. This is a young female and so has particularly small canines. The males often have significant canines as well. Clavicles are present, obviously being a primate. This one's got obviously a microchip, these guys, typical zoo animals, so it's got it between the interscapular area. But again, body form fairly basic, nothing particularly weird and wonderful about the shape other than perhaps the skull shape. The abdomen, though, of some primates can be a little bit more tricky to interpret, and this is a drill, which is a large, related to baboon, a simian, and these guys have got some significant structures. They've got this one's an older female, it's got quite a prominent bronchial pattern, so this one is quite striking in this case. The heart often looks quite large in these cases, but actually this particular one is a normal size and normal function. But what we see is quite a lot of gas and gut fill because these guys are particular herbivorous specialists, and so they have quite a large, often semi-sacculated large intestine, which often has quite a bit of gas in it and a lot of ingesta. Quite a flat liver. The liver often tends to be particularly lopsided in a lot of primates, so it tends to be more right-sided. So when we're dealing with carnivores, we tend to, and a lot of the small herbivores, we tend to expect the liver always to be fairly symmetrical but cranial underneath the diaphragm. in a lot of primates, you don't get the impression on the lateral view here, but we'll see in some ultrasound and some ventrodorsal views, it is actually more right-sided than it is midline. The other thing to note in these cases, tails where they're present, some do, some don't, but they're often quite elevated. Intumescences, so this proliferative area in females around the rear end, and calluses. So ischial pads are common in baboons, drills, and a lot of guenions as well. And these are cartilaginous pads that are often quite closely attached, in some cases, you know, really welded on to the ischium wings, and act as a kind of a seat for the primate to sit on. So they're solid structures, but normal. Excuse me. Spondylosis in older animals is really common, and we see this all the time. So we've got little spondylitic lesions all the way through thoracic, lumbar areas. So these are not uncommon. Arthritis, as with any species, is pretty common. And so here we get a bit of more of an impression of this right-sided, lopsided liver structure that most primates exhibit. And when we get liver enlargement, it usually goes down the right side. So if you're wanting to find an enlarged liver, look right-sided on ultrasound or exploratory. That's the side it tends to elongate. There is relatively little left side. This is where the stomach's going to sit. We've got a bit of gas here from the transverse colon that comes across it. Again, this one is not a bad positioning, but the heart often looks as if, this is a ventrodorsal view, looks as if it flops to the left. So the heart sits again slightly to one side of the chest in the case of a lot of primates, because it's sitting more across the chest, and so it tends to look slightly to the left. You'll be familiar with the fact that your heartbeat seems to be louder on the left side of your chest than on your right side of the chest, and it's kind of the orientation of the chest that you get. Again, fairly stout clavicles in these cases. It's worth noting this is the foot of the drill. The structure of that is a basic quadruped style, but they've got particularly prominent taluses, and of course, depending upon the primate itself, elongate or shorter digits. Arthritis is really, really common. Traumatic injuries, this is a little sesamoid in here, but traumatic injuries to joints, subluxations, dislocations and fractures, really, really common to find these, usually of no obvious clinical significance. The other thing to note is that the cervical vertebrae are pretty short in the vast majority of cases, and so trying to work out neck lesions in primates is actually very difficult. We may see metabolic bone issues, and this is a young chimp that is showing signs of hypovitaminosis D. And even in collection, so we can see this is a chimp of about 2 years old. We've got flaring of the epiphysis at the joints of the long bones. We've got a little bit of a deformity to the rib cage, but it's not that bad, not that obvious. But we certainly have swelling of joints associated with this particular one. Again, note the right lopsided liver and the heart off to the left. And this is typical, as I say, with hypovitaminosis D. And so even in animals that have access to outdoor enclosures all the time, some of them choose not to go outside. And so consequently we have to think about that and provide potentially indoor UV lighting or vitamin D supplementation, particularly for growing animals. The adults may be also marginal vitamin D, which is a potential long-term health issue, but actually won't show clinically skeletal signs. It's clearly going to be the young growing infants that are going to show signs. This particular infant also showed episodic weakness, variable calcium and variable potassium levels as well. So interestingly, with hypovitaminosis D in a lot of primates, when you have low calcium, the potassium gets drawn down as well, because it's often going into the intracellular space, and so the extracellular potassium levels are low. And then we have weird things. This is a hyrax. Do you know what the hyrax is most closely related to? Elephants. And? Close. Hippo? No. No, you're getting on the right, more in the right lines, but manatees, Sirenia, dugongs, manatees. Yes, weird, just weird, plain weird. Yeah, they are most closely related to these species. They have internal testes, so castrating them is a living nightmare. You have to wait until they're slightly big enough, and then it really is a faff, quite frankly, to castrate them. And we've done a few now over the years, and yeah, they're always a joy. They have quite a significant capacious gut, but they have quite a peculiar gut structure. So they have a significant simple stomach, which then moves obviously into a fairly standard small intestine. And then when they get to the ileocecal junction, there is a cecum at that point, and then it goes into a colon, and about halfway down the colon at this point here, they have another little diverticulum with two little horns that looks for all the world like a paired ceci and another kind of little functional cecum. And this area is associated with complex microbial synthesis of, they're obviously herbivores, although they've got pretty impressive teeth and can inflict really rather nasty wounds. They've got really sharp vampire-like teeth at the front. They bite really, really well. And this sort of sacculated area halfway down the colon is an important site for fermentation and volatile fatty acid synthesis, which is then an important source of nutrition for the animal. They are prone to enteroliths, particularly if fed on things like alfalfa or lucerne. And so consequently we do periodically radiograph some of these guys because we have had issues in the past with enteroliths, not dissimilar to those that you see in equids, actually, ironically. Otherwise, they are most susceptible to Yersinia. And they've got quite a significant liver, quite a large liver. As you can see, it's sort of flattened, multi-lobed, and they're prone to iron storage disease. So they're one of these animals that is very good at extracting iron, and like a lot of those species, they are highly prone to Yersinia. So lots of teeth, serrated teeth, the cheek teeth themselves, the premolars and molars, are not continuously growing. They're more like kind of equid teeth that they grow initially and then just wear out. The incisors, however, are continuously growing and are really rather sharp and capable of inflicting quite serious wounds. Again, they're a species that tends to have open growth plates as adults. So that is not an unusual finding. They also have a moderately sized spleen. So they're another one that has quite a significant splenic size, and that's relatively normal on radiographic image. And of course, they've got famously, the forelimbs and hind limbs have got multiple ridges, and they can literally go up smooth walls. They're phenomenal climbers, so particularly well adapted. Marsupials, koalas. We know that koalas have a huge problem with hip dysplasia in captivity and in the wild, and also elbow and shoulder dysplasia as well. We can see various craniofacial tumours. This particular one is a normal head for these guys. They've got these quite sharp looking weird incisor teeth, and then these flat, serrated cheek teeth for slicing eucalypt. And a complete circular eye socket, but cranio-maxillary tumours are not uncommon. But certainly in captivity, we regularly will assess young animals for evidence of dysplasia. We know there's a genetic component to it, as well as obviously clearly nutritional. They have a capacious, again, hindgut, so there's kind of a hindgut fermenter. These guys, and it's worth just noting as well, like a lot of marsupials, they have these epipubic bones. So these are additional bones, as the name suggests. They come off from the pubis in a kind of a Y shape. They support the ventral body wall. They're thought to be there to support the pouch, but they're present in males as well. The vast majority of marsupials have them to some extent. There are a few that don't, like the sugar glider, but the vast majority do. Tree porcupines, North American tree porcupine, so a rodent. So typical rodent dentition here, continuously erupting incisors, prehensile hands, so typical smaller rodent hands, quite stout limbs for climbing, again small chest capacity. Difficult sometimes to interpret what's going on because of the quills, the spines overlying the area. Again, significant hindgut fermenters in these cases, and quite a large liver structure to these guys, but quite stout limbs otherwise. So a relatively typical rodent body plan, and again the heart often looks quite large in comparison to the chest space for these chaps, and quite a significant prehensile tail. And then antelope wise, we're thinking obviously more bovid structure here. So again, initially deciduous teeth shed as young animals, replaced with adult teeth that erupt and then wear and finally wear out. The incisors are continuously erupting, no incisors in the upper jaw. We've got these significant nasal sinuses. They've also got this fairly upright atlas joint, which is prone to dislocation, as with cervids. So when they run blindly into fences, this area clearly is the main weak point. This wave mouth is typical of a normal dentition in these guys, and we would expect to see that gap between the teeth unless we actually had a step mouth. We'll show you some abnormal ones in the next slide. And this one here has got some abnormal teeth. We've also got a jaw fracture in this particular one here, which has actually come out through the bottom, and we've got bone remodeling and infection associated with this tooth root infection. So they're prone to dental disease, particularly with age, and the teeth wear out, and often it's the second or third cheek tooth that causes the issue. We've got a skyline view here, and we can see the abscess in here, this radiolucent area that's then burst out through the ventrum of the jaw that's associated with these teeth. So we can do similar techniques that we would use in small herbivores. This is another marsupial. This is a swamp wallaby. And typical body plan of most wallabies. This one's got a lot of gas in it, to be fair. This is not a particularly normal looking one, but it's quite good at demonstrating the anatomy. So if you can think of this, would be normal if it was filled with ingesta. They have a complicated stomach with 3 compartments to it. So there is a normal sort of sacciform, but there's also a tubiform stomach. And a muscular area, and they're actually stomach fermenters. There is some fermentation going on in the hindgut, but actually the majority of the microbial fermentation occurs in these stomach area. And then in the large bowel, yes, they do have some sacculation, and there is some fermentation going on in there as well. This one has actually got yersiniosis, so it's actually got an enteric disease. Heart again looks quite large in comparison to chest because it's quite a small chest size. Typical marsupial is a male, very obvious external genitalia, very significant, but again has the epipubic bones here on the ventrodorsal one. And again, hand-wise, typical pentadactyl limb. They're diprotodontia, so they've got paired incisors at the front, and then a typical diastema. This one actually also has got some dental disease up here, so we've actually got a fractured crown in here. So again, like the koalas, they'll have deciduous teeth, and then they'll produce adult teeth that will then wear and cease to grow, and then will wear out and will often fracture and break. Similarly, we can get other diseases in wallabies, and this particular chap here has got quite a significant, it's actually upside down, so quite a significant problem. So this radiograph here, lateral radiograph, we can again see the stomach in this area in here. We've got some of the sacculated stomach in here and some of the sacculated intestines in here. And then we've got these mineralized deposits all over the place in little cannonball areas. And this is actually avian TB, and wallabies are particularly prone to Mycobacterium avium, subspecies avium infections, as juveniles, as naive animals. So animals that are being maybe bullied or harried within a group, just naive juveniles that have maybe come off weaning, these guys are quite prone to it. Typical in the liver, as you'd expect with a bird, but actually you can get it throughout the whole of the abdominal cavity. So avian TB, a significant cause of morbidity in wallabies in areas that are endemically affected. This particular chap here, this is actually a western grey kangaroo. Again, we can see part of that saciform stomach here with the house tree in here, this sort of tubular appearance. It looks a little bit like a large intestine, but this is actually stomach here. But this one is exhibiting another common feature. Like antelope and like cervids, they are highly prone to cervical dislocation if they run blindly into fences. Excuse me. And this particular one has done just that. So we've got the atlas here, the axis here, and a clear distraction and subluxation, actually this fracture of the atlas as well. This animal was still able to walk. I mean, you're looking at this thing here on radiograph. This animal was ataxic, but nonetheless walking. How on earth it managed it, considering the amount of distraction that must have occurred in the spinal cord there, I don't know. But some of them are found just dead, but they run into a fence, that 90-degree head, and it just bends down, and this is the area with the weight of the animal behind it and quite a narrow neck that inevitably breaks. There is also, this is an enlarged heart that we've got in here. This animal was in a state of shock, and we often get a megalocardia associated with a shock syndrome in these animals as well. They often become hyponatremic and develop a cardiomegaly.
So it's a bit like a brontomyolysis type.
Yeah, it's more of a shock syndrome. You get a hyponatremia and you get fluid retention, and you actually get an enlarged heart. But yes, you can. You're quite right. They're prone to capture myopathy as well. So all of the macropods, obviously a lot of ungulates, hoofstock, primates and ratites are very prone to rhabdomyolysis associated with intense periods of activity. So, sudden chases, sudden exertion, and that can be a significant cause of morbidity as well. And then other ungulates, this is a typical suids. They're very prone with age to collapsing tendons. They're also very, very prone to arthritis. And we see a lot of osteoarthritis and lipping, particularly in tarsal joints. We can see collapsed tendons associated with these guys. And we can also see pedal necrosis associated with hoof disease. So we can see resorptive lesions going on here in P3. If you look at it in comparison, we can see lots of fluffy epiphytes around the joints with chronic osteoarthritis in these guys. So suids, yes, the age-wise, they'll keep plodding on because it's a suid and they're robust and they're tank-like, but arthritis, a bit like bears, is quite common as they age. So foot care, obviously, very important with any ungulate, but regular radiographic assessment is also important. Spot the species. Armadillo, which one? Oh, tell it's an armadillo. Go on, count them. How many? Go on, say. 3-banded. 1, 2, 3. 3-banded armadillo. So this is the one that can completely snap itself into a ball. This is its defense mechanism. It just curls into a ball, head and tail slot in. Absolutely well-nigh impossible to examine unless you are very quick or anaesthetize them. Lovely digging forelimbs, really stout forelimbs, a lot of power in these guys. Typical dentition, flat peg-like teeth, plate-like teeth, we do get overgrowth. They're continuously growing, and we can get abnormal wear in armadillos' mouths that can cause spurring and issues. No incisors in these guys, heavily plated, obviously, and this is connected to the skin, and you can see these guys make interpretation of radiographs really difficult. It is incredibly difficult to assess even the skeleton, let alone internal body organs in these guys. So yes, a challenge to image these chaps. Okay, so some ultrasound images of these guys, and we're looking here at this Asiatic otter, and this particular one, we've got two images here. This one over here, we've got just a flocculent white lesion with no real discernible detail in it, and then we've picked up on a lesion here associated with a caudal abdomen midline, and we've got another little lesion just in here, and this is a peculiar case. This is septic peritonitis. So this flocculent lack of detail, again, if it was obviously anechoic, then we'd think of ascites, but with this whiteout, this is much more typical of purulent inflammation. This is actually the uterus. And what we've got in here is thickening of the uterus. This is actually an ovary, and actually interesting, this thing had an ovarian abscess, weirdly, and a pyometra. So we do see pyometras, we see similar things that are then leaked into the abdominal cavity and created a septic peritonitis. Typically, like an awful lot of these animals, it was out of sorts, but it wasn't on the floor. I mean, this thing, you know, if it had been a dog or a cat, it would have been, you know, gasping its last. This thing was still trotting around and trying to keep its position within the group. But this one had developed a septic peritonitis. In the case of primates, this is a chimpanzee, the liver structure often looks quite hyperechoic. This is quite common in a lot of primates. There is often quite a lot, particularly in older primates, a lot of scarring. We've got significant hepatic veins, we've got some hepatic arteries, we've got a slightly thicker wall in here. They have often a prominent gallbladder, which is not in this particular scene. We're sort of cutting part of this bit off in this particular scene here. Kidney-wise, these can be sometimes difficult to image because a lot of these primates eat significant amounts of vegetable material and have very gassy bowels. So you get an awful lot of reflection on ultrasound. They can be difficult, a bit like rabbits in that respect. You can sometimes get it and sometimes not. We can sort of get the image of the right kidney, in this particular typical bean-shaped kidney. And in this area here, we've got uterine involution. This is immediately after a swelling, so this is the urinary bladder, uterus in cross-section, and we can see the menorrhea, we can see the lining coming away after a swelling, an intumescence, and a menstruation that's occurring in this particular great ape. And that's normal. Similarly, for small domestic cats and things like that, small exotic cats, I should say, very similar to small domestic cats, not dissimilar images, so similar kidney structures, stomach, we've got this sort of starburst in cross-section at the cardia, kidneys, small intestines, a little bit of pancreas in there, gallbladder, liver structure. These guys image relatively well, easy to see, very little gas usually in the intestines, and therefore not particularly difficult to get decent images of. Okay. Right. So, this is a good question. Yes. Just to go through a couple of case studies. Does anybody want to grab a coffee or anything like that before we... You're all right? We'll plod on. You're presented with a female 14-year-old Hermann's tortoise with post-hibernation anorexia. Blood shows a leukopenia, 0.7 times 10 to the 9, with some toxic heterophils, 3+, uremia, 18 millimoles per litre, elevated AST, 350 international units per litre, lipemia, and clinically there is some evidence of a nasal discharge. So, where would an ultrasound probe be placed, and what would be useful to examine in this case? Go on, say. Femoral fossa, okay, yep, so that's probably a good bet because you're going to get to see the majority of at least coelomic caudal organs in there. What are we particularly going to be keen to look at, bearing in mind that history? Liver, okay, liver, yes, you may well have lipidosis going on. What else? Kidneys, might show you. Yeah, reproductive tract, okay, why?
I think the lipemia, I've been wondering if this was somewhere in an ovulatory cycle.
Yeah, okay, and what are we concerned about, bearing in mind, I appreciate some of you haven't done the reptile one yet, but bearing in mind it's a testudo female.
Just wander around with follicles.
Follicles, yeah. Yeah, we may have pre-ovulatory stasis in this particular case. We may have egg yolk coelomitis. You know, it may have gone into hibernation with pre-ovulatory stasis, and during hibernation, that shutdown has resulted in immune system shutdown, and then we've got a secondary bacterial infection, and we've got an egg yolk coelomitis, you know, around in this. We've got toxic heterophils. We've certainly got dehydration, so yes, kidneys may well be affected. The liver certainly is not looking too good, so yes, lipidosis may be an issue, or hepatitis may be an issue associated with egg yolk coelomitis. So yeah, we definitely want to have a look and see, have we got floating egg yolks in here? What have we got? What radiographic views may also be useful include positioning and any special techniques.
Probably a standard 3 view.
Yes, okay.
But it might be worth doing a skull view, potentially, that nasal discharge.
With a nasal discharge, yeah, you may want to look at the head in more detail. Yeah, 3 views, so definitely we want to have a look at the lung fields, and we want to look at a lateral in particular and a craniocaudal. A DV is not going to show us much in the lung field, but again, if there is potential for reproductive activity, you might want to have a look. Sometimes they have ectopic calcified eggs in urinary bladders and things like that because they've had previous issues with reproductive problems. But yes, we're particularly wanting to look at the lung fields. What additional imaging technique may be helpful should a lung granuloma be identified? Yeah, endoscopy. And yes, it obviously depends on having the right client, and it depends upon, you know, how much money they're going to be willing to put up with it. But ultimately, if we want to put it on the right antibiotic, and actually in some of these cases, some of them are fungal. Do be aware that some pneumonias, they're not as common obviously as bacterial, but every now and then you get a fungal pneumonia. There are plenty of them recorded in the literature: aspergillosis, Paecilomyces, Bovaria bassiana. Any one of these ones can cause a fungal focal pneumonia, which clearly is not going to work with as much Keftaz as you wish to chuck at it. So you might want to actually say, well, look, you know, best practice is, I've identified there's a granuloma there. I'm going to, under anaesthesia, drill down on it, sample that. Actually, what I've then got is a port that I can directly medicate the granuloma. So actually, if it is something really tricky to treat, like a fungal infection, then actually I can put my drug straight onto the site of the infection. I don't have to worry about trying to get systemic medications into this animal. I can just directly dose it by putting, you know, a sterile dressing over the top and then periodically popping that into the actual hole itself. Okay. African grey parrot presented to you with a history of increasing exercise intolerance and over the last few days loss of voice. What immediate imaging technique would be of most use in this case? Tracheoscopy could be, yes, okay. Yep. X-rays, okay. Yeah, so what are we thinking here in the first instance? What is our main concern? Aspergillosis. Yeah, absolutely. So yes, often reported by owners as he's getting a hoarse, you know, voice. He's got a sore throat. Now we know that the voice comes from down here in the syrinx, so it's going to be syringeal. That's a good place for an aspergilloma to form. Increasing exercise intolerance also possibly suggests that it may not be confined to the syrinx. It may actually be in air sacs and lung as well. So yes, immediate endoscopy may be useful to have a quick look. But yes, then radiography certainly may be useful to follow that up. 2 images. Ventrodorsal often is the most useful, but actually always take 2 images in the first instance. What additional ultrasonography techniques may be helpful to identify the extent of the problem include positioning and access points? Yes, so we can use the liver as an acoustic window, and we can look at the heart and we can look at the liver itself. we may want to look at the heart, because actually, yes, okay, we're making the assumption this is aspergillosis. Certainly it all sounds like that, but increasing exercise intolerance, remember, parrots, atherosclerosis is really, really common. So actually having a quick look at the heart while you're there is no bad thing. Have we got a pericardial effusion going on here? Have we got a very thin-walled heart? We may well get a bit of an idea, obviously, on the radiographic imaging as to heart size. And remember, we can look at the heart width. We can compare it to the fifth pair of ribs. Should be less than 50% of the width of the chest at the fifth pair of ribs if it's a cetaciform. That's a rough rule of thumb. Yes, we can use the liver as an acoustic window, because otherwise, what's the problem in birds? We've got air sacs. We've got things that just do not help ultrasound transmission, unless it's got ascites, at which point life becomes a little bit easier. Okay, you're presented with a 2-year-old lop breed domestic rabbit. There is obvious incisor malocclusion and bilateral periocular milky discharge. What radiographic views would be helpful to make an initial assessment?
Lateral VD and oblique lateral skulls.
Yeah, okay. So we can look at a straightforward lateral and DV, and yes, obliques would probably be useful in this particular instance to see whether or not we actually have any particularly mandibular extension of apical buds. What contrast studies could be used? Yeah, so we can use a Conray or equivalent iodine-based contrast injected through the lacrimal ducts to look and see whether we've got pinching. And we mentioned, and it was a good point, I can't remember who it was who showed me the image, but we mentioned that the most likely area of pinching would be the apice of the incisors, where the duct actually dives underneath the incisor, the upper incisor root, before entering the oral cavity. You occasionally, with premolars 1 and 2, get issues around the actual lacuna, the actual little dilatation of the tear duct, because those teeth sit immediately underneath there, and if they elongate up and push out, they will impinge upon that, and they can affect the draining. So they rarely block, but they often can cause irritation and inflammation. So sometimes it can be cheek tooth associated. It rarely, as I say, blocks it completely at that site, whereas the incisors often do. But further up, yes, you may want to have a look at that. And we kind of covered that particular one with additional views looking at skyline issues. What I'll try and do, because that is that. Can anybody tell me how a Mac works?
You want to close the window left side?
Left side?
Left top, yeah.
Oh, it's that one. Okay. Traffic light system. Okay.